Hello, my name is Denise. I'm going to be doing the assessment today on DEEP. I washed my hands, performed hand hygiene. I'm going to start by asking the patient a set of questions. Can you tell me your name?
Deep Singh,
Where are you?
the hospital,
Okay, and what is today's date?
April 29, 2022.
Okay, the patient is alert and oriented times 3. I'm going to test remote and recent memory. Can you tell me who the first president of the United States was?
Mr. George Washington.
Okay, very good. And then recent memory, what did you have for breakfast today?
Eggs.
Can you spell umbrella?
UMBRELLA.
Okay, very good. So patient's memory is intact and spelling is intact. Next, I'm going to, and patient's voice is clear. I'm going to have you hold on to this. Just leave it on your knee. Hold on to that for a second, and I'm going to take a set of vitals on you, okay?
Okay.
Okay. Very good. Okay, hold on for me for a second. That's good. And then while I'm taking the set of vital signs, I'm going to assess for the pulse deficit first by palpating the brachial pulse and then the PMI, which is in the midclavicular line on the left side, fifth intercostal space. So palpating the pulse deficit with the PMI and the brachial pulse. As I'm doing this, I'm noting the patient's respirations, which are normal, no retractions. They're about a 12. And there is no pulse deficit. The heart rate is about 86 apically and radially. And the pressure is 123 over 72, which is normal. All right, great. Next, I'm going to take a look at the patient's head. Looking at the head, it's symmetrical. Any pain in the scalp area?
Nope.
Okay. Patient's head is normal cephalic, atraumatic. There are no lumps, scales, bumps, or lesions. Looking at the hair, it is coarse in texture and even distribution. Looking at the face now, I'm going to test cranial nerve number 7, which is the facial nerve. So lift up your eyebrows for me. Good. Eyebrows are symmetrical. Press against my fingers, please. Push up. Yep. Good. And then 5 out of 5 strength on those with your eyelids. And then shut your eyes tight. Good, and then smile, frown, puff out your cheeks. Good. All normal. Cranial nerve number 7 is intact. Next, I'm going to check cranial nerve number 5, the trigeminal nerve, the motor part. Bite down using your masseter. Bite down. Good. And then the temporal part. Bite again. Good. 5 out of 5 strength. I'm going to check the temporal artery, which is about 2+. For the trigeminal nerve, the sensory part, I'm going to take 2 objects, a sharp and a dull. A sharp and a soft, and tell me what you feel on the forehead, the cheek, and the mandible.
Soft.
Sorry.
Sharp. Soft. Sharp. Soft. Soft. Sharp.
Okay, very good. So trigeminal nerve number 5, sorry guys, is intact. Right, so now that I've done that, I'm going to palpate the frontal sinus and the maxillary sinus. Any pain?
Nope.
Okay, so all the sinuses are normal and the facial symmetry is intact and good. There's no breakdown on the face or scarring. So next I'm going to take a look at the lymph nodes, looking at the preauricular, the postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, turn that way for me, deep cervical chain, posterior cervical chain, and supraclavicular above the clavicle. All right, so the lymph nodes are intact. Next, I'm going to move on to the eyes. They're equally set in distribution and size. Looking at the eyebrows, they're also normal texture and distribution. The medial and lateral canthus are also equally set. The eyelids, there's no ptosis, no drooping, no swelling to the eyelids. I'm going to press on the lacrimal ducts. Any pain?
Nope.
No pain or discharge, which is normal. I'm going to take a look at the patient's conjunctiva, which is pink. Everything looks good there. Next, I'm going to visualize the eye. The sclera is white, the iris is brown, the cornea is translucent. So everything looks good on this eye, and then the same thing looks good on the other eye. Next, I'm going to take a look inside of the eye. Looking at the eye, I'm going to look for the red reflex, which is present. The retinal vessels are intact. The macula and the fovea are visualized. I'm just going to take a look also on the same thing in the other one. So yeah, the macula fovea are intact. Retinal vessels are intact. No opacities. Cup to disc ratio is about 0.3, and disc margins are sharp in both eyes. Everything looks good on the eyes there. Next, I'm going to test for cranial nerve number 2, the optic nerve, using first the Snellen chart, the visual handheld. Please tell me the lowest line that you can see.
LTFPH.
Cover one eye and read it again.
LTFPH.
And the same on the other eye.
LTFPH.
Okay, patient's vision is 20/20 bilaterally, 20/20 in the left, 20/20 in the right eye. Next, moving on, I'm going to test for confrontation. Tell me when you see my fingers.
See them? I see them.
Okay, cranial nerve number 2 optic is intact. Next, we're going to test for 3, 4, and 6 cranial nerve, ocular, motor, trochlear, and abducens. And that's 3, 4, and 6. So I'm going to start by doing direct and consensual light reflex. Shine the light in one eye, look for constriction. Shine the light again in the same eye, look for constriction in the opposite pupil. I'm going to do the same thing on the opposite eye. Shine, look for constriction. Shine again, look for constriction in the opposite eye. That's intact. Next, we're going to do 6 cardinal fields of gaze. Please follow my finger only with your eyes. And then in convergence and accommodation. So that's all normal. The pupils are equal, round, reactive to light. Perla is achieved, and they are set equally as well. Everything is normal with the eyes. Next, we are going to move on to the patient's nose. There is no gross deformity. Everything is symmetrical. Any pain when I'm palpating on the nose?
No.
All right, we're going to test cranial nerve number 1, which is the olfactory nerve. Tell me what you smell.
Vanilla.
Okay, good. And I'm going to include one nair, press, and blow. And then the other side. Good. Cranial nerve number 1, olfactory, is intact. Patient sense of smell is intact, and the nairs are patent. Next, I'm going to take a look inside the nose. I'm going to pull up the nose and just insert my speculum, in. I see the nasal turbinates, which are patent. The nasal mucosa, which is pink. There are no nasal polyps, no nasal polyps. Nasal mucosa is pink, nasal turbinates are patent. No septal deviations, no scarring, no perforations, and no discharge. So everything looks good inside of the nose. All right, so now that we've done the nose, I'm going to move on to your ears, okay? So ears, just going to palpate on the tragus, the mastoid bone. Any pain?
No pain.
Looking at the shape of the ears, everything is symmetrical. There's no redness, no erythema, no drainage on the external part of the ear. Everything looks good there. The ears are equally set. I'm going to go ahead and take a look inside of the ear. Okay, and this is the left side. So I'm going to go ahead and pull the pinna up and back and look inside the ear. I see the tympanic membrane, which is pearly gray. The cone of light on the left side is at 5 o'clock. The malleus and pars placida are visualized. Tympanic membrane, pearly gray, no perforations, no scarring, and we said the cone of light already, which is at 7 o'clock for the left side. And I'm going to take a look at the same ear on the other side. The cone of light on the right side is at 5, tympanic membrane, pearly gray. The malleus and the pars placida are visualized. No scarring, no perforations, and there was no edema, no fluid collection in there as well. So everything's normal with the internal part of the ear. Next, I'm going to test for the cranial nerve number 8, which is the vestibulocochlear, or the vestibulocochlear nerve, or the acoustic nerve. So I'm going to grab my tuning fork. We're going to do several tests: the Weber, the Rin, and the gross hearing test. When I strike the tuning fork, tell me where you hear the sound.
Both of my ears, lateral.
Was it equal or not equal?
Equal.
Okay, good. That's intact. Next, we're going to do the Rin test. Tell me when you no longer hear the sound behind your ear, and then when you no longer hear it in front of your ear. Okay?
I don't hear anymore. I don't hear anymore.
Okay, we're going to do the same thing on the other side. Only one.
I don't hear anymore. I don't hear anymore.
Okay, so that's the Rin test. AC is greater than BC, air conduction greater than bone conduction. The patient should hear the sound in front of the ear longer than behind the ear, so that's a normal finding. The last test for the cranial nerve number 8 is the gross whispering, is the whisper test. It test for gross hearing. I'm going to include the ears, step back, and whisper. Tell me what you hear.
1, 2, 3.
Okay, and we're going to do the same thing on the other side.
1, 2, 3.
Okay, very good. Gross hearing is intact. That nerve is intact. So We're going to move on from the ear to the mouth. Looking at the outside of the mouth, everything looks good. No fissures, no cracking, no swelling. The lips are pink. Everything is symmetric. I'm going to have you stick out your tongue. Stick out your tongue. Say ah. Okay, good. So the hard palate, soft palate are intact. The buccal mucosa is pink with no lesions or patches. Stick out your tongue. Looking at his tongue, it's pink and midline, and everything looks moist inside there. The tonsils are about a 2+ with no exudate present, so that's normal there, and everything looks good inside of the mouth. I'm going to test cranial nerve number 9, the glossopharyngeal nerve. So I'm going to have you, and also cranial nerve number 10, the vagus nerve. So I'm going to have you go ahead and take a sip of water and then tell me your name again.
Deep.
Okay, patients, there's no hoarseness in the voice, so that's a normal finding for this nerve. And then I'm going to go ahead and just grab the tongue depressor and go ahead and, okay, good. Sorry about that. That's the gag reflex, which is intact for cranial nerve number 10, the vagus nerve. So 9 and 10 are intact. Moving on, I'm going to test cranial nerve number 12, which is the hypoglossal nerve. So go ahead and stick out your tongue, lift it up. Good. Nothing, no lesions underneath the tongue. It's moist and pink. Press against my fingers with your cheek, with your tongue, sorry, and then the other way. Good. Strength in the tongue is 5 out of 5, no deviations when the patient lifted, stuck out their tongue. So hypoglossal nerve is intact. So that's cranial nerve number 12. We're going to just test the spinal accessory, cranial nerve number 11. Shrug against resistance for me. Good. 5 out of 5 strength there. Spinal accessory nerve 11 is also now intact. So now that we've done the mouth, we're going to take a look at the lips, which are normal, and the mouth is normal. Moving on, I'm going to look at the neck, okay? So looking at the neck, everything looks normal. There are no deviations, no masses present. There is, trachea is midline. Everything looks good, there are no pulsations. Next, I'm going to move back and going to test the thyroid. Okay, all right. So go ahead and let me give you a cup of water. Go ahead and swallow. All right. So the thyroid is intact, no nodules. Any pain there?
No pain.
No goiters, nothing like that. So everything looks good there. Next, I'm going to take a look at the chest. I'm going to just have you take off your shirt. Sorry. Yeah, my bad. All right, so looking at the chest, there are no lesions, no breakdowns. I'm going to test the symmetry for expansion. Go ahead and take a deep breath in, and then let it out. Okay, very good. And then turn around.
This one?
Yeah. And then chest expansion in the back as well. Take a deep breath in, and then let it out. Good. So there's normal chest expansion there. The apical diameter is about 0.7, which is normal, no barrel chest. Looking at the front and the back of the chest, there are no lesions, no breakdowns. Turn around for me one more time. I'm going to palpate the chest. Any pain when I'm palpating here?
No pain.
Okay, great. So no pain. Go ahead and turn around one more time for me. I'm going to start
This one?
the way you were.
Oh.
Yeah.
Alright.
Go ahead. Okay. So after I'm done palpating the back of the chest, any pain?
No pain.
Okay, great. Now I'm going to start by percussing the chest. All right, resonant upon percussion. I'm going to do diaphragmatic excursion next. Take a deep breath in deep and hold it for me. And I'm going to percuss down and mark the level, and then let it out and hold it. And I'm going to mark the level again. We're going to do the same thing on the other side. Deep breath and hold it. Percuss down. I'm going to mark it, let it out and hold it. Okay, and mark that. That should be about 4 centimeters. Diaphragmatic excursion, looking for the level of the diaphragm, and that is normal. All right, so now that I'm done percussing, I'm going to go ahead and auscultate the chest. Take a breath in. Breath. When you feel my stethoscope, say the word E. I'm going to test for egophony.
E, 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 E.
Next, please whisper the words 99 testing for whispered pictoriloquy.
99,
Whisper.
99.
Okay, and then I'm going to test for tactile firmness. Please, when you feel the ulnar side of my finger, say 99.
99, 99, 99, 99.
All tests negative for consolidation. The lungs are clear. On the outer lobes of the lungs, I hear vesicular sounds. On the inner part, closer to the spine, I hear bronchovesicular. Please now turn around for me. Okay, I'm going to turn one more this way. I'm going to assess, percuss the anterior chest. Okay, and resonant percussion, and next I'm going to auscultate the chest. Take a breath. All right, great. So that's all good. Chest is normal. Next, I'm going to move on to the carotid pulses. Okay, I'm going to palpate for the carotid on one side, and then I'm also going to palpate again for the carotid on the other side. It's about a 2+, which is normal. I'm going to auscultate for bruits with the bell. Okay, so everything is normal there. No bruits present, no pulsations to the neck anywhere. All right, we're gonna go ahead and do the chest heart assessment. So go ahead and have a seat. Yeah, just sit up for me. Sit up. Yep. Okay. So I'm going to first look at the chest. We said earlier the rate and rhythm is symmetrical. Looking at the heart, I'm gonna identify the landmarks: aortic. Second intercostal space, right sternal border, pulmonic, second intercostal space, left sternal border, tricuspid, fourth to fifth intercostal space, left sternal border, and mitral is fifth intercostal space, midclavicular line. I'm going to auscultate with you any pain.
No.
I'm going to palpate for heaves and thrills first. So no heaves or thrills present to the chest. Next, I'm going to auscultate the landmarks to listen for the heart sounds and for bruits. First with the diaphragm. And then with the bell. Lean forward. Same thing. And with the bell. Okay, and then I'm going to have you do this at a 30-degree angle as well. So lean back onto the bedroom. Let's just bring this computer closer. Okay. All right, so the same thing. Auscultate. And then so while I was listening to the chest, I only heard S1 and S2 throughout all of the landmarks. I didn't hear any S3, S4s, no murmurs, no bruits, no clicks, rubs, anything like that. Everything looks good at the heart. Now I'm going to take a look at the jugular venous distension. So I'm going to take my card, and I'm going to use the side of centimeters. I'm going to put that at the top of the sternum, and then I'm going to take a pen, And then I'm going to check for the internal jugular where the pulsations are visible. So turn your head that way for me.
Sure.
Oh, sorry guys. Okay. So go ahead and turn. And I'm going to measure the internal jugular where the pulsations are and measure that angle. So from the IJ to the top of the sternum, that angle is about 4 centimeters, which is normal. The patient doesn't have any JVD, like if they were to have heart failure or anything like that. Everything's normal with the heart. Next, I'm going to have you lay down and I'm going to listen and look at the abdomen. So the abdomen, looking at it, there are no pulsatile pulsations where the aorta is, no masses, nothing like that. Everything is normal. Looking at the abdomen, there is no breakdown of the skin. It is flat. Next, I am going to auscultate all of the quadrants, starting in the right lower quadrant. Listening for bowel sounds. Bowel sounds are normal active. There's about 12 present. And then I'm going to percuss, listening for notes of tympany. The abdomen is tympanic throughout, which is normal. Then I'm going to palpate, light palpation first, and then deep palpation. I don't feel any masses so far. Any pain?
No pain.
Nope. Everything is looking good then in the abdomen. I'm going to find the liver, which is on the right upper quadrant, and I'm going to palpate under for the liver border. So the liver is palpable, which is normal. The edges are smooth. Next, I'm going to percuss for the liver, starting on the nipple line. I'm going to percuss down, and then mark it. And then I'm looking for areas of resonance to dull. Once I hear the dull, I will mark that. And then I'm going to percuss up from the umbilicus to dull. So hearing notes of tympany to dull and measuring that distance, okay? So after I've done that, the liver border is about 6 centimeters in the normal patient, which deep has. Then I'm going to palpate for the spleen. So the spleen is actually not palpable in this patient, not palpable in normal healthy patients, which is a normal finding. And then I'm going to percuss for the spleen. Please take a deep breath in and out. Okay. Only tympany is heard percussing for the spleen, which is a normal finding. If the spleen was enlarged, you would maybe hear dull sounds in that area. So everything's good with the abdomen. All right, so now I'm going to have you stand back up. All right. Go ahead and have a seat. Okay. All right. All right, so now that we've done the abdomen, I'm going to take a look at the patient's skin. The patient's skin is normal, no breakdown, no lesions, no masses. It's appropriate for ethnicity. Feeling the top of the hands and the legs. It's warm and dry. There is, no sweating or anything like that. Next, I'm going to look at the patient's hands for any kind of cyanosis, as well as their toes for any kind of cyanosis. No cyanosis present. I'm going to check capillary refill, which is less than 3 seconds, in the hands, which is normal. And I'm going to check it in the toes as well, which is normal. Then I'm going to look for any edema, just make sure there's no pitting edema in the upper and the lower extremities, no edema, which is normal. The last thing I'm going to check for is any clubbing. Please go like this with your fingers. Yep. Go ahead one at a time, looking for any clubbing or deformities in the fingernails. There is no clubbing, which is normal, and looking at the toes, there's no clubbing there. There's no induration. Everything looks normal on the patient's skin. Next, I'm going to kind of look at the temperature of the skin. Everything is normal. I'm going to look at the pulses of the skin. So checking for the brachial pulse, 2+, the radial pulse, 2+, brachial pulse, radial pulse, 2+. We're not doing femoral, but I would check femoral pulse there. And next I'm going to bring this down. Check for the, bring it back. that's fine. Dorsalis pedis pulse 2+, and then posterior tibial pulse 2+. Dorsalis pedis pulse 2+, posterior tibial pulse 2+. Okay, that's fine. Okay. All right, so now that I've looked at the pulses, I'm going to look at your spine. So go ahead and stand up for me. All right, turn around. All right, so looking at the spine, press against my hand, and then the other way. Good. 5 out of 5. Flex your neck down, then back up. Good. Looking at the range of motion of the cervical spine, and then push against resistance. Good. 5 out of 5. Turn around. All right, next I'm going to take a look at the back of the spine, the C-spine. Any pain when I'm palpating anywhere?
No.
Okay. Any pain in the paraspinal muscle area?
No.
So no pain to the spine or the paraspinal muscles. Everything is normal there. Next I'm going to have you bend over, touch your toes, and then come back up, and then back. Okay, good. A full range of motion in the spine. While I was doing that, I was assessing the patient's posture, which is upright, and curvature of the spine. There's no kyphosis or lordosis or any abnormal spine processes. The shape is good. So everything is normal with the spine. I'm also going to have you just turn around. So I'm going to palpate the jaw area. So stick your jaw out, move it side to side, and in a circular motion. Okay, good. So full range of motion in the jaw area. All right, so now that I've done the spine, going to do the musculoskeletal portion. So I'm going to start by palpating everything. Just make sure this doesn't go off. Okay, good. I'm going to start by palpating everything. Any pain in the shoulders?
No pain.
Okay, any pain in the elbows?
No pain.
Any pain in the wrists?
No pain.
Okay, and then any pain in any of the fingers?
Nope.
Okay, good. So there's no pain to the upper extremities. Any pain in the hips?
Nope.
Any pain in the knees? Any pain in the knees?
Nope.
Okay, any pain in the feet?
Nope.
Okay, so I'm palpating the ankles and the toes. Okay, I'm looking for symmetry in the shoulders, the elbows, the wrists, the fingers, the knees, the ankles, the toes. Everything looks symmetrical, and there's no pain. Next, we're going to test range of motion in all the extremities. So abduct your shoulders, bring them to your body, bring them forward, and then bring them back. Okay, so full range of motion there. Next, I'm going to have you bring your elbows forward and back. Good. Full range of motion in the elbows. The wrists up and down, and the fingers up and down. Okay, good. Just for the fingers, this is the metacarpal, MCP, PIP, and then DIP in the fingers in all of them. And in the toes, stick your toe up for me so the camera can see. MCP, PIP, MTP, PIP, and DIP. Okay, bring it back up. Okay, good. So range of motion, we did this, we did this, we did this, and the fingers, right? So lower the camera down. Flex and extend your foot, your knee. Good. Full range of motion in the knees. Do the other one. Okay, good. And then your feet, open, flex and extend, and then your toes, open and close, flex and extend.
Hold on.
Yep, do them on both sides. Good, and then the other one. And then the knee and the toes. Okay, very good. So full range of motion, and then the hips. Stick your hip out. Come closer. And bring the camera down. Yep, stick your hip out. Abduct the hip. Adduct the hip, bring it behind you. Forward and then back. And do it on the other side as well. Good, so full range of motion in your as well. So now we've done range of motion, I'm going to assess the strength in the patient's upper extremities. So I'm going to test the strength in the bicep. So push against my hands with both arms. Push. Biceps. Good. 5 out of 5 strength in the biceps. Triceps. Go ahead. Push. Strength in the shoulders. Lift your shoulders up. Push against my hands. Push. Good. And then down. Good. And then at both sides. Good. 5 out of 5 in all the upper extremities so far. We're going to do the wrists now. Push against my fingers. Push. And then the other way. Push. Good. And your hands. Push. And then push against me. Push me. No, the other way. With your fingers. Push me out. Good.
Okay.
Yep, good. Okay, so fingers, shoulders, elbows, fingers, wrists, everything is normal, 5 out of 5 strength there. We're going to test the hip, push against my hand with the hip. Good. And then the other way, push against the hand with the hip. Good. Sorry. And then the other way. Good. And then the knees. I'm going to have you go ahead and sit. Push against my hands. Good. This is testing the quads. Good. And then the hamstrings. Push in. Good. Push in. Good. Next, I'm going to test the strength of the lower extremities where the feet are. Press on the gas. And then push up with your feet. Good. And the same thing with your toes. Push down and push up. Go ahead. And the same thing. Push on the gas. Push up. Toes. And then push up. Good. 5 out of 5 strength on all of the upper and lower extremities. Go ahead and have a stand up for me again. We're going to assess muscle tone now. Muscle tone. Okay, so go ahead and I'm going to lift your hand up. Looking for muscle tone. Looking for any kind of flaccid muscles, any hypertrophy in the muscles. Everything looks normal. So this is muscle tone of the upper extremities. We're going to assess muscle tone in the arm. Everything is normal. Like I said, no flaccidity in the muscles. We're going to test for supination and pronation. Supination and pronation. So everything looks good there. And then I'm going to have you go ahead and sit on the bed. Yep. Okay. All right. So then I'm going to lay down, please. All right, so we're going to test the hips, external rotation, internal rotation, and the knee. Good tone in both. Again, the other side, external rotation, external rotation, internal rotation, and the knee. Good. All right, you can go ahead and stand back up for me. All right. Good. All right, so now go ahead and have a seat, please. All right. So, going to assess the tendon reflexes in the brachioradialis, bicep, and then the brachioradialis. Sorry guys, I'm going to do that one more time. So I'm going to assess the muscle, the tendon reflexes in the biceps, and then I'm going to do the triceps. Good. Brachioradialis. Lean your hands on them. Good. Same thing on the other side. Biceps. No, move over. Move over. No.
Sorry.
It's okay. Sorry. Good. And then brachioradialis. Lean. Good. And then the patellar reflexes. Yep. Relax. Good. And then the Achilles. Let's bring the camera down. Okay, so I'm going to relax your hand on my foot. Relax your foot on my hand. Good. And then the Achilles. Relax. Good. And then I'm going to do the Babinski. Hold your foot out for me. Going to check for the Babinski reflex. The toes should curl in, which is a normal finding. And that is normal. Babinski toes curl in. If they were to fan out, that would be abnormal. Let's bring the camera back down again. All right. Next, I'm going to test sensory. So I'm going to test several things for sensory. So first, close your eyes and tell me what you feel.
Pain.
Good. Close your eyes.
Soft.
And we're testing the upper and lower extremities. So what was this? Describe this.
It was like a pinch. Pain.
Okay. And then
Pain.
what is this?
It's a sharp feeling.
Okay. Good.
Sharp.
And then what do you feel?
Vibrations. 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 Vibrations.
Okay. I'm going to place something in your hand. Close your eyes. What is it?
A key.
Okay. Very good. The last thing we're going to do is balance. Okay. Stand up for me. Alright, so what we're going to do for balance is I'm going to have you, Okay. Touch your nose and then touch my finger whenever it moves. Go ahead. Good. Next, we're going to test for supination and pronator drift. So go ahead and stick your arms out and turn them up and close your eyes. We're going to assess this for 15 seconds. The patient does not sway, does not move. The gait is upright. The posture is normal. We said the curvature of the spine earlier was normal. Good. No pronator drift there. Okay, very good. You put your hands down. Next, we're going to do the heel to shin test. So come and sit on the bed here. Just lower that down a little bit. Good. All right. So go ahead and put your heel to your shin and bring it down. Yep. Testing for balance and coordination. Good, and that's normal. All right, next I'm going to have you stand right here. All right, and then you're going to walk to the wall, heel to toe. Put your heels in front of your toes and walk straight line. Good. All right, and then back, you're going to walk on your toes. Yep, come back. Perfect, good job. And then on your heels. You're going to walk just straight on your heels. Okay, good. And then walk back normally. All right, looking at the gait, everything is smooth. We talked about the posture already. We did balance. And yeah, I think that concludes everything for today. Thank you.